Okay, to rescue or CPR for an adult casualty. So, me and my invisible partner here have come across a person who is unresponsive. Okay, so we're gonna have one person stop and check for hazards: fire, wire, gas, glass, traffic. No hazards. Okay, are you okay? No first aid. Can I help you? Checking for breathing for 5 to 10 seconds. Okay, we're gonna activate EMS because this person's not breathing. Bring back an AED and make sure you know the number for EMS is 911. Okay, so the first rescuer is gonna perform compressions. And the second rescuer, provided they have a barrier device, is going to do the breathing part. So I'm gonna count out loud so my partner knows what number I'm on. 1, 2, 3, 4, 5, 6, 7, 8, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 24, 25, 26, 27, 28, 29, 30. You really want to minimize interruptions here. So my partner over here is going to have the head tilted and ready, and they're going to perform 2 breaths while pinching the nose and making sure the chest goes up and down. Okay, thank you, partner. 1, 2, 3, 4, 5, 6. Okay, 28, 29, 30, and they're giving 2 breaths. Okay, pinching the nose. Okay, and I'm doing the compressions again. Okay, I am obviously gonna get more tired quicker because I'm using a lot more effort in doing compressions. 30, they give 2 breaths. That's 3 cycles. So I wanna switch after 5 cycles. Okay, 28, 29, 30, they give the 2 breaths. They're over there doing that. Okay, so after my set of 30 compressions, I'm just gonna loudly say switch so that my partner knows that I want to stop doing the compressions. Okay, this only works if I have my own barrier device. If they are the only ones that have the barrier device, I have to continue doing compressions because I don't want to put my mouth on this mannequin's mouth without a barrier device. Okay, but luckily I have a barrier device in my back pocket, so I'm going to be able to switch properly. Okay, so we're going to switch at 30, 28, 29, 30, switch. Okay, so they're going to give the 2 breaths before they switch. Okay. So they give the 2 breaths and they're lining up for compressions, and I'm gonna hold the head up to maintain an open airway while they're giving the breaths. Okay, so switching roughly every 2 minutes or 5 cycles is the way to do this. Okay, now that option, that variation, only works if you both have a barrier device. Okay, again, if one person has a barrier device, the other person doesn't, the barrier device person will stick to the breathing part. Okay, let's say you both don't have barrier devices and no one's going to go mouth to mouth on this mannequin. The option is just switching compression only CPR. So in that situation, we're going to switch roughly 2 minutes, which it ends up being about every 200 compressions or so. Okay, so okay, so I have a watch on, so it's easier to tell when the time is ready. So we're gonna switch in 10 seconds. Okay, and switch. Whew, and I take a break while my partner does the compression only CPR. Okay, so that is 2 rescuer CPR. Some points here to remember when activating EMS, getting an AED. Okay, with adult casualties, we're essentially activating EMS as soon as you determine the person's unresponsive, not breathing. Okay, and then begin your CPR protocol, starting with compressions first, ventilations at a rate of 30 to 2. Okay, again, your landmark is in the middle of the chest, between the nipples, on the lower half of the sternum, and your partner can maintain an open airway when you are doing the compressions. Okay? Okay. Yeah, I think that's it for that sequence. 2 rescuer CPR for a child. Okay. So again, it's very important to minimize interruptions when we are doing CPR. Especially when we're switching back and forth. We really want to make sure that switch lasts less than 10 seconds. Okay, Your heart doesn't stop, so we're trying to minimize that, okay? So for CPR, two rescue CPR for a child, the sequence begins very similarly, okay? There is a slight difference in the ratio of two rescue CPR for child, infant versus adults. So a child is aged 1 to 8. Children and infants usually go unresponsive due to a respiratory problem. So they benefit more for the circulation of more oxygen. So in other words, instead of 30 to 2, we're gonna go 15 to 2. Doing the math there, that is double the amount of oxygen. And when there's two rescuers, there's less interruptions, there's less stopping and pausing. It's more fluid, okay? So when there's two rescuers CPR for a child or an infant, we use the rate of 15 compressions to 2 ventilations, okay? So let me demo that. We have an unresponsive 5-year-old casualty here. Does anybody know this child? Oh yeah, it's my child. So I'm gonna give myself permission to assist. Okay, no dangers to myself. No. Are you okay? Open your eyes. Checking for breathing for 5 to 10 seconds. Okay. They are not breathing. So I'm gonna activate EMS 911 if the arrest was witnessed, or if I have someone to call 911 for me. Okay. And with two rescuer CPR, of course, you do have someone to call 911 for you. Okay. Just this little side note before I show you the demo. If you are alone without access to a phone and you did not witness the cardiac arrest, you did not see what happened, we're going to begin 2 minutes, 5 cycles of CPR before we call 911 to get that oxygen circulating throughout the child's body. Okay, but back to this scenario, I have 2 rescuers. One person's calling 911, second person is going to begin the CPR protocol, okay? So 1, 2, 3, 4, 5, 6, 7, 8. So remember, it's 30 to 2 if I'm by myself, and it turns into 15 to 2 when I have 2 rescuers, okay? So my partner comes back right away, they call 911, they're using the speaker function on their phone, so they haven't even left the room, okay? 14, 15, they're over here, okay? And they're gonna deliver 2 breaths with enough oxygen to make the chest go up and down. Okay, 1 cycle, 2, 3, 4, 5, 6, 7, 15. They give 2 breaths, 2 cycles, 1, 2, 3, 15. Okay, they give 2 breaths, that's 3 cycles. Okay, we switch after 10 cycles for a child, because remember, the ratio is now 15 to 2 for child and infants. Okay, so I'm on my 9th cycle. I know that was really fast. I'm on my 9th cycle, okay? 14, 15. Okay, they give 2 breaths. We're gonna switch after this cycle. I'm gonna say that clearly to my partner, okay? So you're gonna give 2 breaths, then we're gonna switch. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15. Give 2 breaths, okay? Switch. So I move over here and I landmark for my breathing. So they're doing compressions at a rate of 15 to 2 with 2 rescuer CPR for a child infant, okay? Okay. So, so now we practice doing that, okay? So some emphasis points here. With children, I use 2 hands in that situation because these mannequins are quite hard to get the depth needed. You can use 1 hand when doing CPR for a child. I just like to use 2. The depth is about 2 inches, 5 centimeters, or 1/3 of the child's depth cavity, okay? Again, the ratio of compressions, if you're alone, is 30 to 2 at a speed of 100 to 120 beats per minute. And then it changes to 15 to 2 when there are 2 rescuers, just to ensure the adequate oxygenation for child casualty, okay? How old is the child again? 1 to 8, that's right. And yeah, so again, when we're switching our compressions from compressions to ventilations, you really want to minimize the interruptions. So you want to make sure you do that within 10 seconds or less if possible. Okay. Always when the AED arrives, we're going to use that as soon as you can. Okay.